Hi, my name is Brooke. I'm an occupational therapy assistant student, and I'm here to explain and discuss bipolar disorder. Bipolar disorder is a mood disorder that has alternating periods of high highs, called manic episodes, and periods of low lows, which are called depressive episodes. Those with bipolar disorder have depressive episodes, which might make them have sleep issues, feel worthless, feel guilty, lose concentration, or have suicidal thoughts. And that obviously can impact their daily life because it can make it hard to get out of bed, to go to work, go to school, complete work and school assignments. If the person with bipolar disorder has kids to look after, it's especially hard because not only are they looking after themselves and trying to navigate their own daily life, they're also trying to help those kids out and run them around. The occupational therapy assistant can help by offering them like medication orders and different interventions. A great way that works well with those with bipolar disorder is to help collaborate with them on a schedule that kind of keeps them on track and helps them organize their life a little bit. For manic episode assistance, those who experience manic episodes have really elevated moods. They can feel like they're on top of the world, that they don't need any assistance, and that they can do anything. And this can cause them to partake in some pretty risky pleasures, like making dangerous sexual decisions, making dangerous legal or financial decisions. A common choice is to quit their job suddenly or start a new business that they have no previous background in. That can obviously impact your daily life a lot. And so it can cause rifts between families. It can obviously cause some pretty big legal and financial backlash. And the occupational therapy assistant can help by giving resources for behavioral management. Like I said again, helping you to manage your medication, helping you to establish your social role, especially within your family, to help you be the best that you can be inside your family. There are 3 types of bipolar disorder. The first is diagnosed with a single episode of mania. Bipolar 2 has at least one single depressive and one single hypomanic episode. And the last is cyclothymic, which is kind of like mild bipolar disorder, is what it's sometimes called. And its depressive and hypomanic episodes don't technically meet the criteria of depressive or manic episodes. The treatment that is most common and works pretty well for those with bipolar disorder includes stabilization and management. That's something that the occupational therapist can help especially with. In creating those schedules and helping medication management, different tactics to try and stop and think and understand the desire behind the mood. Psychotherapy works really well, like that cognitive behavioral therapy we're talking about. That works best for depressive symptoms, but it does also work with manic symptoms. Education is great. You can't really have enough of that, especially for the family members of those who have a loved one with bipolar disorder. Medications work pretty well, and they're pretty common with bipolar disorder. Mood stabilizers, antipsychotics, those are most effective when taken together. And branching off that antipsychotic medication, a common manic symptom is psychotic episodes. And so that can lead the person with bipolar disorder to be misdiagnosed with schizophrenia. That's why it's so important to advocate for yourself. If you feel like schizophrenia is not a diagnosis that matches with what you're experiencing, it's important to advocate for yourself, especially to the occupational therapy assistant, and also to your doctor. Another medication that's common is antidepressants. Antidepressants can be kind of a tricky one because sometimes they can trigger a manic episode. And so you really have to watch those and how you're feeling on them. A good community resource is the Bipolar Foundation. It has a lot of good resources for interventions and sort of tips and tricks to try to stabilize yourself and to handle your symptoms. It has a lot of good resources for education for family members, for support groups. Overall, a great resource. It's important to remember that the occupational therapist's goal is to empower their client. And so always speak up in your care and remember that the occupational therapist is there to help get you back on track to what you love, to what makes you feel the most fulfilled, not merely to fix you or get you back to where society wants you, but to get you back where you think you would most be happy. Thank you for listening to this talk. I hope you've learned a lot more about bipolar disorder. And just remember that the occupational therapist is there for you and seeks to empower you to the best of their ability.